are going to be getting some updates very soon. Since our last presser, which we had yesterday, a lot of things have changed. You'd have seen the updates this morning where we were upgraded to a tropical storm warning and a hurricane watch. You would have also seen a notice that out of an abundance of caution, we did move our classes and our schools to the remote environment. And so those are two key updates so far. The agencies of government have been working, and you will hear all about that this morning. The Met Service, usually we start with them, but they had an important meeting with the National Hurricane Center, so we're going to change the order. Usually we start with the forecast, but this morning we're going to be starting with Minister Tufton, who is going to give us an update from the Ministry of Health standpoint. They're very, very important in the preparedness and also in the response mechanism of government. And so we'll have Minister Tufton first. When he is finished, we expect that the Met Service team will be ready by that time, and we will have them and Minister Samuda, and then after that, we will have Minister Vaz come to you. So first up is Minister Tufton. Good morning, Minister.
Thank you, Minister. And let me just welcome and recognize my colleague ministers in the audience who have been mentioned before, members of the civil service group, including my own permanent secretary, Errol Green, and I also have with us our head of the emergency services in health, Dr. Dawkins Wright, who is prepared to elaborate on any specifics related to our preparedness. So I'll give you an update on and what the possible impact of the storm is likely to have on the health services. So we do anticipate, even though we hope not, that given what is being projected, that there will be some disruption in our health services, interruption of supply chains, including for medications, the possibility of injuries from wind damage, debris, and falling trees, the risk of waterborne or vector-borne diseases from flooding and stagnant water, challenges to our most vulnerable, among them people living with chronic diseases, the elderly, persons with disabilities, pregnant women, and children. So there's likely to be an impact on the entire society, or entire lives, and we need to prepare for that. The Emergency Operation Center is now fully activated within the Ministry of Health and Wellness. It's a 24-hour center which keeps in touch with all the collaborating agencies and mans from that space the response that is required throughout the country. And that is up and running. We continue to prepare our efforts across the island, and we have had a number of consultations over the past number of days with the regional health authorities and other stakeholders. So these are some of the specifics. All public hospitals will now enter emergency mode. This means that while hospitals remain open, outpatient services and elective surgeries will be suspended for the time being, focus on the emergencies. Visitations will be limited, and family members are asked to pick up their relatives who have been admitted for non-critical reasons, and the respective hospitals will reach out to those family members. We have to reserve bed space just in case we need them for emergencies. In terms of health centers, we remain open until 4 p.m. today. A further update on our health centers will be provided tomorrow. So up to 4 p.m. you can access health centers across the country. We have 325 across the country. In terms of the system readiness, there are approximately 116 priority facilities 25 hospitals, and 91 type 3 to 5 health centers. A verification exercise has been conducted with key capacity indicators, which include the following: human resources, some 702 personnel identified and are on standby across parishes for emergency response activation. All assessed facilities have documented staff welfare measures in place, so we have personnel in place. Secondly, command and control, 100% of priority facilities have established identifiable command centers to coordinate emergency response operations with clearly defined roles and responsibilities. Backup power systems, 75% of priority facilities have functional backup electricity systems, generators with fuel reserves, capable of sustaining power for some 72 hours post-disaster. And the generator project has equipped some 21 primary care facilities, increasing the total to 60 facilities across the country. This is for primary care, health centers. Medical gas and supplies, 100% of priority facilities have sufficient medical gas supplies, estimated to last some 72 hours. Strategic stockpiles of medications and medical consumables have been verified and are maintained at a minimum 72-hour level. Infection prevention and control, 100% of priority facilities have been documented infection prevention and control protocols and visibly in place. Transportation fleet, 87% of priority facilities reported having fully functional transportation or vehicles fleet for emergency response and patient support. Communication capacity, 75 UHF radio systems available for mobile response teams. Based on radio check, JICA emergency communication project is in operation in some areas as of July 2025. Starlink backup communication system have been tested in Western region for enhanced redundancy. So we are putting in and have put in communication systems to be able to communicate if there are disruptions in normal channels. Surge capacity, hospital inpatient capacity of approximately 5,000 beds, 20 operating theater units, 19 emergency rooms across the public system. And there are plans for the rapid redeployment of mobile response teams if required. And there's one functioning field hospital, which is currently being deployed at the Maypen Hospital. Multi-sectoral coordination, parish, hospital, and National Health Disaster Committee meetings have been convened. The Water, Sanitation, and Hygiene Coordination Committee has been established and engaged with partner agencies, including agencies that are here, the NWC, UNICEF, Food for the Poor, JDF, and the NWA. I want to just use the opportunity, having given these specifics, to encourage Jamaicans to work with us to ensure their safety and good health during this period. Ensure that you have at least 72 hours of essentials in a storm-ready kit, somewhere that it can keep dry, okay? And storm-ready kit is sophisticated sounding, but it could be a plastic bag. Ensure that you include in this non-perishable food. Spoiled food can be a source of serious health concerns if you have no light and your refrigerator goes down. So the tin stuff, right? And other non-perishable foods. Water is essential because water-borne diseases tends to be the logical consequence after a storm. Medications, flashlight, battery-powered radio, and extra batteries. It's important that the public take the next number of hours to prepare themselves. If you have chronic illnesses like diabetes, hypertension, kidney disease, respiratory ailments, ensure that you have your medicines and know how to take them if services are disrupted. And we do encourage persons to communicate with their health provider in anticipation of the possibility of disruption. So whatever clarity they need, they can get before. We also would like to say and encourage you to stay tuned to updates, and I'm sure there may the Met Service and ODPM and so on that will give updates, but the Ministry of Health will also provide updates as necessary, and the extent to which you can get those updates from main media, traditional media, otherwise you should. However, my closing remark is that be also cautious around the social media communication and ensure that it comes from sources that are credible. In disasters, we tend to get a lot of misinformation. Everybody is an expert, and we could create confusion in that way. So we discourage those who would like to be an expert but know they are not from communicating unless they're absolutely sure. And we certainly encourage the public to stay tuned to the recognized and authoritative sources around this. Thank you very much, and we wish all a safe passage through this storm.
Thank you very much, Minister Tufton. And I know that his permanent secretary is here, Errol Green. I acknowledge you, Permanent Secretary in the Ministry of Health and Wellness, and he is also going to be staying to answer some of the questions at the end. So we have a lot of updates to get through, and the man of the moment, usually you're used to seeing Evan Thompson, but today we have a really wonderful person from the Met Service, Rohan Brown, who will be the one that will be providing the update. And so he will be coming to do his presentation. And after that, we will have Minister Samuda coming forward also. So please welcome Rohan Brown from the Met Service, a new voice for us here. Thank you.
Good morning, everyone, and thank you, Minister Morris Dixon. At this time, the Meteorological Service continues to closely monitor Tropical Storm Melissa, which has shown a slight increase in forward speed, but remains a slow-moving system across the central Caribbean waters. Now, for those tracking as of 10 a.m., the center of Tropical Storm Melissa was located in latitude 15.5 degrees north, 74.9 degrees west, or about 215 miles southeast of Kingston, Jamaica. The system is moving slowly towards the northeast near 7 kilometers per hour, and maximum sustained winds are up to 75 kilometers per hour with higher gusts. Now, we have gone from a tropical storm watch to a warning because tropical storm conditions are likely within 36 hours within the Jamaica area. And we have also gone to a hurricane watch because hurricane conditions of 119 kilometers or more in terms of wind speed are likely over Jamaica over the next 48 hours. Now, little strength in forecast is expected over the next day or so. But what is interesting, we just had a discussion with the National Hurricane Center, and coming out of that, we'll protect and bless Jamaica land we love, and we are going to plan and prepare for this storm. Thank you, Minister.
All right, you heard it. That's the update. We're going to switch order a little bit and have Minister Daryl Vaz now come to give the update, and I saw Digicel in the audience now too. So they are also going to be available to take your questions at the end. So even if you don't hear them give an update, they are all here. Everybody that I announced is here to take questions. Welcome, Minister Vaz.
Morning, ladies and gentlemen, colleague ministers, PSs, and of course, heads of agencies and partners. So, the Ministry of Energy, Telecommunications and Transport cover a number of essential services, which I know there are questions that are being asked. So I'm going to give an overview. We have heads of agencies here. We also have President of JPS and others that are here, Digicel and Flow, Stephen Price, who is here from Digicel. Okay, and Digicel. which are critical stakeholders of emergencies such as this. So as the country continues to prepare for Tropical Storm Melissa, Ministry of Energy, Transport and Telecommunications has been working closely with our utility providers, transport entities and telecommunication providers to ensure a coordinated national state of readiness. I'm going to leave JPS for last. And I'm happy to see my good friend Hugh Grant here. So let us start with Petrojam. We have activated all refinery emergency systems and confirmed sufficient fuel supplies, over 2 weeks worth of refined products, and 10 days of LPG following the storm. Loading facilities in Kingston and Montego Bay will extend hours to support pre-storm deliveries, and Jamaica Aircraft Refueling Services, JARS, is fully stocked with jet fuel and aviation gasoline to ensure continuous aircraft refueling. Flow Jamaica has fully activated its crisis management system with support from local and regional teams. Power resilience has been strengthened with over 61% of mobile sites now having backup power and 143 new generators installed island-wide. All generators are refueled and serviced, and field teams are mobilized. Company's Emergency Operations Center is active, and the public can reach the center for emergencies at 876-929-9834. I'll repeat that, 876-929-9834 and 876-929-9837. That's 876-929-9837. Digicel has formed a dedicated disaster response core team to ensure continuous operations during the storm. Company has strengthened communication redundancy with satellite phones and backup connectivity through other providers. All network sites, towers, and facilities have been structurally inspected, and generators confirmed to be up and running condition. Essential spare parts are secured locally and overseas, and mobile cell sites are ready for rapid deployment to restore service. Digicel has also conducted safety training and weather simulation drills to enhance preparedness and technical response. Transport, Jamaica Urban Transit Company, JUTC, will maintain regular bus operations as long as conditions are safe to do so. Service updates will be shared via social media and public channels. 30 buses are designated for emergency deployment across depots in Portmore, Spanish Town, Rockport, and Montego Bay. Each depot has activated an emergency operations committee, and the JUTC representatives are embedded in national and parish emergency centers for coordinated response. All depots, fuel stations, and assets have been secured, and the company is prepared to support evacuation and transport efforts if needed. Montego Bay Metro, Western Transport Operations, remains fully operational and will continue to provide service as long as weather conditions allow. Toll Authority, highway operators, very important. Highway operators are now on alert to respond to any emergency direction that the minister may issue when it becomes necessary, which means that if the storm or the hurricane is creating panic and the highways are congested, I will give the direction to open the highways, toll booths, free of cost to the commuters during the period of the storm. Airports Authority of Jamaica, important for those of you who may be planning to leave. Emergency protocols are fully activated at Jamaica's international airports in preparation for tropical. At Manly International Airport, PACAL has directed stakeholders to secure assets and complete drain cleaning, structural checks, and power system tests. Both airports will expedite reopening once safety is confirmed, with updates shared through official bulletins, social media, and coordination with airlines and government partners. So the question that is being asked out there, is there a possibility of the airports being closed? So I made sure to clarify that with the Airports Authority. The minute that a hurricane warning, not a watch, a warning has been issued, it is likely that the airports will close within 24 hours. It is not a must that both of them will be closed at the same time. It's all dependent on the tracking of the storm or the hurricane and the elements in terms of the locations of the two airports, which are obviously on the sea. So for right now, airports remain open, and the only time that we will move to close the airports will be if the Met Office issues a hurricane warning. If that was to be predicted or projected, that would probably be sometime tomorrow into Saturday. So sometime between tomorrow evening and Saturday day. But best thing is to monitor, and the hurricane warning is the trigger. So let's end my briefing on JPS. JPS has reported to me that they have fully activated the command centers under the new incident command system and placed overseas line workers on standby, with 31 of them already in Jamaica for pre-storm preparations. To boost resilience, critical control and telecom sites now have 48-hour backup power and new Starlink systems for communication continuity. The company has expanded its fleet with over 115 specialized vehicles to enhance post-storm response. Vegetation management and grid reinforcement have been intensified, especially in key transmission areas across western and eastern parishes. JPS is coordinating closely with national agencies and utilities to ensure safe access and timely and consistent customer updates. So this is welcome news to me, and it obviously is as a result of our experiences of Beryl. So I want to say that I can see that the JPS is being proactive, and I see Mr. Hugh Grant here, and I know he and I will be having several conversations between now and whenever the event, as I know that he would not like. He would not like for he and I to have the same words that I had last year, this time with Beryl. I want to say a few words. You want to wait until after Minister Samudra? You can do now. And just to say to JPS, I know that you are doing tree line clearing, and I know I have reported already that some of your contractors, who I'm sure are being paid to remove the debris, are finding the easiest way, which is the gullies across Jamaica, which are only going to make matters worse for us. So I'm asking you, please, sir, as a matter of duty today, to make sure that those areas are inspected and satisfactorily signed off by JPS, and not rely on those contractors who have a habit of finding the shortest route to make the best and the most money. Zero tolerance. So, ladies and gentlemen, based on what I have told you here, I think the most important update is that of the JPS, and I am confident that we will manage, if necessary, much better than we managed based on the lessons we all learned coming out of Beryl. And you can rely on this administration and my colleague ministers and myself to be vigilant and to hold those accountable and responsible for an efficient response in all areas. Thank you. You want to say something, you?